West Virginia doesn't have the opportunity to claim victory very often. 16% of the population lives in poverty and the state is plagued by drug abuse. But right now, it's among the highest performing in the US when it comes to rolling out the COVID-19 vaccine.
Did that surprise you?
Yes, because we're usually 49th and 50th and everything. Yeah, except obesity and other things, bad things.
One of the keys to their success has been relying on local pharmacies instead of big chains.
It helps us to know that the patients who would be more inclined or interested in having it done, they come to us, they trust us. They're here a couple times a month to see us. The customers, we're part of their community.
It was a deliberate choice by the governor in the predominantly rural state that's seen more than 134,000 COVID cases. Now 13% of the population are inoculated. One of the major issues in other states has been people not showing up to their appointments. Pharmacists like Christine Knott have stayed open late and worked the phones to make sure no one missed out.
We lost 0 doses. Every dose went into an arm. I'm very proud to say that. It was a lot of work to make sure we didn't lose any. There was obviously many people on a waiting list, but we made sure that there was none that went to waste.
Christine was asked to help supervise the rollout for the local school county. 700 teachers and staff are now vaccinated.
I'm glad they've been so on top of everything. I've heard stories of colleagues from Virginia, Maryland, even back in Connecticut, who are struggling at this point to try and get the vaccine.
No one's required to get the vaccine, and not every teacher opted in. Even in this large group, they haven't wasted a single dose.
We've had folks who something happened and they couldn't get here right away. And she says, well, I'll be down at the pharmacy until 7 o'clock. If you can get down there before then, I can help you. That kind of relationship and flexibility lets you capture everybody.
But sometimes it means tough conversations with those who've lined up to get their potentially life-saving shot.
We had 1 vial left, but we only had 6 people, and we sat down with each one of them and explained that a vial holds 10 shots and that we didn't want to waste it. So we set them in a separate group and said, if you could come back in 2 days when we can get 4 more people and get them all scheduled, we can use the whole thing and get all 10 of you. And we did, and she scheduled it at the pharmacy, and all of those people had driven all the way down here and waited and came, but they all understood.
One of the key metrics for success isn't just making sure that the dosages are distributed, it's making sure they get in the right arms at the right time. And that's where West Virginia has also excelled. Over 85% of the dosages used to full effect.
West Virginia is like coming in first with all of this, but we are, which is great. I mean, makes you proud.
There's still a fair way to go. 80% of West Virginians are still waiting on their first shot. The advice here, for those wondering, is much the same as everywhere else.
Get the vaccination, you know?
Annalise Nielsen, Sky News in West Virginia.